really relying on some of the partnership organizations of where we're recruiting for and from, looking to see what resources they currently have so that we're not pulling those nurses. And really, I rely heavily on our recruitment teams to find reputable resources and teams to work with and to partner with, that we're not all pulling from the same locations, the same countries, all at the same time, that we're spreading them out and really making sure that we are doing our due diligence for those individual nurses and providing them the resources that they need when they get here, as well as making sure that we're not pulling 40 individuals from one section or one country, but that we really have 40 nurses from 40 different areas. And then I think it's super important for those nurses to be successful when they're here. In the past, we've added English is not my first language courses, because it's super important that they can communicate with the other nurses in the healthcare team, but they can also communicate with their patients. So they are coming to a foreign country to work. So they have to learn not only the medical pieces and the components, but also just the day-to-day language and sometimes slang, depending on your regions and what that dialect looks like as well. But we almost always offer English is not my first language courses through our schools, to be able to partner with them to help them be as successful as possible. And then also partnering them with preceptors that might have had similar experiences. So somebody that they can create a social network with to be as successful as possible. The last thing that you want to do is move an individual from their home country to help support you and your team and not provide them the resources to be as successful as a nurse, but also successful just, as a human.